without wasting time, I would like to introduce Dr. Akhil Kapoor. He's officer in charge, Tata Memorial Hospital, Varanasi. And Dr. Saab is going to take us through the role of advocacy groups in the management of public funded hospitals and setups.
Thank you, Vivek. Thank you, Vijay sir. So let me share the slide. We have an expert panel consisting of experts from throughout the various parts of the country, including from Northeast Assam, Dr. Venkat, and from TMH Sangrur, Dr. Alok, then Dr. Amit Agarwal from the Central of India, AIIMS Raipur, then Amol Akhade sir, my favorite from Mumbai, and Dr. Atul Batra from newly formed AIIMS Sajjar. Apart from Dr. Kushal Gupta, who was my senior at TMH and now working as a medical oncologist at AIIMS Kalyani. So, yeah, so I would like to share my slide. Please allow the same. Yeah, thank you. So, a very important discussion just happened about the importance of the various advocacy groups and the importance of how to support treatments, which includes costlier treatments, including targeted therapies, robotic surgeries, and proton beam treatments and CAR T therapies. So that was very important to see that all the experts are coming to a single consensus that yes, these are important to be incorporated for the best possible outcomes for the patients, including the quality of life, not only the efficacy. So I would like to start with Dr. Amit Agarwal. Dr. Amit Agarwal, I would like to get your comments. So you have got settled at AIIMS Raipur now, and what do you see? And when we were working at TMH Mumbai, now you are at AIIMS Raipur. What differences and challenges you face, which are completely different from the work which we were doing at TMH Mumbai?
Thank you, sir. So, sir, there is a lot of difference which I noticed and found while I am working here, because ours is a newly established center where the department is new. The things are not that streamlined because we know that cancer treatment just not comprises of surgery or chemotherapy or radiotherapy or immunotherapy. It's a whole process, starting from the disease diagnosis, and even before that, the screening and the awareness amongst the public, then treatment, obviously, then palliative care, support. So, patient support groups and the patient advocacy groups, these play a very vital role to streamline all these things, because patients, especially in the countries like us, patients are many a times illiterate. They have so many constraints like financial constraints. They have limited place to stay. They travel from far distances. So these challenges ultimately, they because of these challenges, the patients are not getting proper treatment. So these advocacy groups and support groups are very much needed, and probably over the period, the government and the policy makers will realize the need for these groups in each and every hospital, whether it's a government funded hospital, public funded hospitals, and that's the need of the hours, sir.
Yeah, thank you, Amit. So you beautifully summarized the important points. So this is an important problem. Though the treatment might be available, the importance of proper follow-ups, proper reach to the patients, and making the patient understand is very, very important, and seems to be easy on the outside, but when you start working on the real work front, it seems to be actually difficult. Now coming to Alok boss, Dr. Alok, you got settled at TMH Sangrur, which is a newly, comparatively a very new setup, and now the footfall of patients is significantly rising. Now, how do you see the role of advocacy groups for improving the patient care at your center?
Thank you, Akhil. Thank you, Vijay sir, and all for the invitation. So, very simply, I just want to say what I understand advocacy group is. So, for me, an advocacy group is any intervention or anything which is making the patient journey through his treatment easier. So that to me is an advocacy group. It can come from anybody who is helping the patient to understand the treatment, improving access to the treatment, making a compliance better, making his follow-up better, acting as a bridge between a doctor and a patient. Anything, it can be it can be a medical social worker, it can be a keyword which we have at our centers, it can be any volunteer which is coming. So anything which is, so this is an essential part, as Amit told, that it's not a single person who can treat a disease. This is a multifaceted treatment, and how much our treatment is effective is dependent on how much the patient understands our treatment, how much he can assess the treatment, and how compliant it for treatment. So advocacy group is as important as the treatment we are providing to have the outcomes which we expect from the treatment, which we see in clinical trials. So we have to have that outcomes in the real world to make it accessible. Advocacy groups are very, very important.
Yeah. So it is now the answer seems to be loud and clear from Dr. Alok that advocacy groups are actually very important, and it is anything which is helping the patient to start and continue the treatment journey, and it able to take the journey comfortably. Because what happens, it's very distressing for a patient to get first diagnosed with a cancer. It is a very big challenge at that point, and at that time the patient and the family is usually very devastated, and they are not able to understand what might happen in the subsequent steps. It becomes very difficult. First, understanding of the treatment, the stage of the disease, then the treatment perspective, all seems to be very much difficult, because this is a difficult disease and it has significant effect on the mental health of the family as well. So it's not only the patient's problem, it's the caregiver journey is also very difficult. And we understand that, yes, the caregiver burnout is also very important, and we have seen that. And now we have started a study on caregiver burnout, caregiver fatigue as well. So that is very important to understand in the busy setups where the caregivers have to do a lot of work and take care of the patients. So I would like to take comment from now Dr. Kushal. Kushal was, if you are available for comment. Now, you can see that new setups are coming throughout the country. Multiple AIIMS Institute, multiple new TMS setups are coming up. Now, sometimes patients, those who are somewhat affordable to travel, they are always in a hurry to travel to metro cities. Instead of taking the treatment which might be available at the local place, they always want to rush to the metro city for getting treatment, because there is a sense of belief that there might be better treatments. So what should be done? How should what might be the role of advocacy group in this, and how should the things will change? What do you think?
Dr. Sab, I think Dr. Kushal and Dr. Amol Akhade could not join.
Okay.
Can I reply this, Akhil? I may not be a doctor, but as
Yes.
a group, can I do this?
Yes. Please go. Please go ahead.
Okay. So I'm going to take only TMC Varanasi as an example, because we have exodus of patients coming in, especially thoracic and head and neck patients. I don't know if they're coming to the city for what reason exactly. But in palliative, when I ask them, or even for that matter, early palliative care, when I go and meet the patients, one thing I get to hear, I'm very sorry to say this on a platform like this, but I think as somebody who's now so much wanting to create a advocacy group, you must know this as to why they are marching the thing. So हर बार मैं उनको पूछता हूँ, the answer that I get is, I tell them, you people are taking so much trouble, with your bare minimum money that you got, you're selling your establishment. One person is here, half the families are there, double establishments have to be done. Why are you traveling to Bombay? I mean, it's not that you should not be very happy to do, but when you have a facility, such a nice facility within 100 kilometers, as close as that, so you could save so many indirect costs, and you can also concentrate on the the wellness of the patient. And flat, they give us one reply telling them, sir, हमको बम्बई आना है क्योंकि हमें यहाँ पे इंसानियत मिलती है. This is the answer that they give. So therefore, I think as a torch bearer of this, advocacy, a lot of thinking has to go behind not only the physical structure of the advocacy, but why the advocacy is being aimed at. And when you're looking at quality of life as a whole, then how this advocacy group is going to play a role in various aspects is what I think some kind of assurance to patients is what has to come from all of you.
Yeah, so it seems that the social support is very, very important, just beyond the providing the quality treatment. So the counseling, proper somebody should be there to hear the patient and their family properly. And that's, I think, most of the centers which are newly set up, they have a poor infrastructure in terms of the social support and medical social worker department.
Right.
That seems to ramp up. And I think we should take this point to our authorities and administrative teams that a social worker team needs to be strengthened at all the centers which are getting newly developed, because these are the heart of the patient support, and whatever the best possible treatment a doctor might provide, it has to be guided properly. It has to be the patient should be able to share their problems with the social team and talk their heart out. So that is an important point.
Akhil, I'm not a panelist over here. Can I come in if the organizers permit?
Sure.
Yeah. So see, as an oncologist, what I feel, so we have been trained in Tata, and now see, lot many patients go in private. So if there is a uniformity of treatment, we can guarantee, and patient is assured whether he's treated at metro or at his native place. If there is a guideline, we all follow together, and if there is a uniformity in it, I think that fear, going to Mumbai will have, as he rightly said, humanity and other factors. Because see, the Tata Trust has built over a period of decade. So and now we are going to the places, and after COVID, the healthcare also strengthened in the rural or 2, 3 or 3 tier cities. And the word cancer comes with a lot of fear. Right? Everybody wants the best possible things. So if you have a guideline and everybody follows the same guideline across the institution, I think that is one of the important factor which can lead to getting down this fear, and people will start treatment at native place rather than rushing to the metros.
Yeah, Akhil, Dr. Akhil.
Yeah, please go ahead.
Dr. Alok here. So I agree with Dr. What Venkat sir said and what Ganpati sir and what Bharat sir said. But I said that if we take a DMH as an example, it has been 75 years. It is a pioneer always in the cancer treatment, and a new center which is coming will take time to get to a level and a trust building which will come. But definitely, if as Dr. Bharat sir said, the treatment protocols through NCG now are getting uniform throughout the country. And when you talk to the patient, the trust which you can give to the patient, the confidence which you shows in the patient, and then as you said, that the medical social worker, the patient navigation which is there, the ease of treatment. So one is treatment, one is the ease of treatment which you can give at these centers. If that is even lesser than what it is in TMH Mumbai, the hassle of traveling to Mumbai, we can have a lot of decentralization which can be done, and which we are seeing now with Varanasi and Sangrur and Uhapo. We are seeing that a lot of patients which are going to Mumbai are coming because now when they talk to us, and the trust and the type of treatment which are able to provide here, the exodus has definitely decreased now, and that trust need to continue as TMH has made, and that advocacy groups helping and telling the patient, counseling them that yes, the treatment could be equal, and the patient should see it in the ground that the same is happening. That will help in making that a reality, the decentralization which we are aiming for to give the treatment at the doorstep.
So it's very clear that this confidence builds up over time, and this is a mouth-to-mouth, as we say for any commercial product, we say is a mouth-to-mouth publicity. It is mouth-to-mouth conviction which goes through the institute as the institute matures actually. So I think that is rapidly coming up for some of the centers which have now established in the last 5 years. Hopefully, this will be helpful for a large number of patients. In fact, what happened, what we see now, the number of patients at TMH Mumbai have not decreased, but these patients who are now coming to TMH Varanasi or Sangrur or Muzaffarpur, they were never able to reach Mumbai. So we see a lot of those patients also, those who were not able to reach any of the dedicated cancer centers, and they are now able to get a quality care. Hopefully this can improve further over time. And again, here comes the role of advocacy group to guide the patients, to guide their relatives. And as it was discussed in the last panel as well, that it is important to form a advocacy group disease wise, like we have started doing for lung and bladder cancers. Similarly, head and neck advocacy groups are coming up. So these will be pioneer, and this will be very, very important to set up the context and bring out the best. So now let's take a comment from Dr. Atul Batra for barriers of comprehensive care at Tier 2, Tier 3 cities. Sometimes it is difficult, but what are the actual barriers and what should be done? Dr. Atul, are you available for comment?
अतुल ये ठीक कर लो, ब्लूटूथ ऑफ कर दो.
Dr. Atul? If not, I think I can ask this to Dr.
He's
Amit
there.
Agarwal.
I think he's facing some challenge related
Yeah,
to.
yeah. Dr. Amit, now what are the important barriers? I think you put a small comment on in during your answer to the last question that there might be some barriers. Can you highlight those barriers and what could be done to tackle those barriers?
So, sir, as I told you, it starts even before the diagnosis because in Tier 2, Tier 3 cities, we generally get patients, especially in setups like ours, public funded hospitals, who are not that much literate or many are illiterate. They have financial constraints. So, the lack of awareness amongst the public, which precludes them from reaching to the hospitals, it is one of the greatest barrier which comes and it leads to a significant impact on the quality of life, impact on the journey of their cancer treatment. So probably advocacy groups can help in this regard. They can create these awareness camps, and they can they can actually influence the policymakers and the government administration to create awareness amongst the public regarding the early diagnosis, regarding the screening of cancer, and they can make them aware about reaching the hospital on time. They can make them aware about importance of compliance and follow up. So these are one of the challenges which we regularly face. Apart from this, financial constraints are always a problem. So, but now we have various government schemes like Ayushman Bharat. Like in our state, the Mukhyamantri Vishesh Swasthya Sahayata Yojana is there, which can give up to 20 to 25 lakhs if the needed and if it is justifiable. So, but many patients are actually not aware about these schemes. Many who are actually who can actually avail these treatment, but they are not aware. So, make them aware about these schemes because there is a lot of fear about the finances, the distance which they need to travel, their place to stay in a far away distance. So and also these social support groups can influence the policymakers to streamline these available schemes. These schemes are available, but many those are actually who are in need of these services cannot avail these treatment because of some probably किसी का राशन कार्ड नहीं है, किसी का कोई आधार कार्ड नहीं है. So because of lack of these things also, so we need to streamline these things as well. And also, as I told, the role of social workers, the policymakers and the institute administration should be very much important. Services like social worker groups should be available in all the hospitals.
Yeah, so it's very important that sometimes patients do not have the knowledge that they can apply for some of the funds, some of the schemes which are already available in the hospitals and in their states or at the central level. So it's very heartening that most of the time at our center we have now a dedicated lung support team actually available with me throughout the OPD, that all the patients who are consulting us, they are at the same time, just after consulting the doctor, they are being counseled in detail about the various funding options, various treatment options, and apart from that, the government health schemes which might benefit the patients. So I think that is one of the way to improve the patient adherence, because you might talk of the most advanced treatment options which are available, but if it is not financially feasible, the patient is not going to come back the second time itself. And in spite of thinking and doing best on your part as a doctor, the patient will have a poorer outcomes because there will be no good follow-up. So here now I would like to discuss, I come to Dr. Venkat. Dr. Venkat is doing an excellent job at one of the corner of the country's northeast, which was initially significantly lagging behind, but now with the setup of the cancer foundations and the funds with the help of Tata Trust, I think that has completely changed the ball game in the northeast states. Dr. Venkat, your comments, how you are coping up and how the advocacy groups can help you further.
Yeah, Dr. Akhil, good afternoon. So happy to see you. Yeah, so I sit in an area, Tejpur, it's quite far from, even in Assam, the Assam is a very large state, so very difficult to access. Till 2 years ago, till 2021, there are only two districts which have main facilities for oncology treatment. The Guwahati, the Kamrup urban area, and Dibrugarh. They are the two extremes of the Assam, and most of the people have to travel like 8 to 10 hours even to get a single chemotherapy or any investigation for that matter. Now, Assam Cancer Care Foundation is opened by Government of Assam in collaboration with Tata Trust, 7 centers across the Assam. I work in Tezpur, which is adjacent to Kaziranga National Park, and believe me, although it is integrated, it is really the capital, cancer capital of India. So here, in a small center like in Tezpur, I see on an average 5 to 10 new cases of various types, which is really high for such a small center. So when we come to this question of gaps on the patient side for proper follow-up, yeah, there are so many. The first factor is the awareness. For example, while I was working in Delhi, women finding a small lump in the breast will come for mammography screening or to go to a physician. But here, the women, there are some of the women, I'd say I cover 5 districts in Assam and some parts of the Arunachal till Tawang, the China border. So all these patients, they have this hospital at the nodal area. So they seek opinion from here. Previously, they used to go to TMH, CMC Vellore, Apollo Chennai, etc. Now, one of the most important things lacking is awareness. As one of the previous speakers is telling, the prolonged treatment, if it is not discussed initially, they think that after surgery, adjuvant treatment may not be needed, and they default. And awareness among the doctors is also very much lacking because so many patients operated for simple cholecystectomy have gallbladder cancer. They do not collect the HPE report. After 1 year, they come with a metastasis. When we ask for the surgery, when we get the report, it's actually malignancy. So they didn't follow up. So educating the patients, educating physicians, because initial contact for many of the patients are these primary physicians in the practice. So not treating breast cancers on FNACs, to do ER/PR HER2 at least. So practicing basic minimum standard of care is also challenging in the practice. In the initial 6 months, majority of patients didn't believe that chemo can happen in their hometown or in the home district. So they used to come to us, talk to us, and then go to TMH. So what I used to do is, I used to write the opinion. This is my plan. As Bharat sir said, uniformity in the protocol. I used to say that this is the duration of treatment. This is the chemotherapy we are going to give. This is the duration of radiotherapy. This is the surgery we are going to offer. You go there, show this to the physician, and if it is same, if you want to take here, discuss with the physician in TMH that oncology facility is available here. And many a times we get the referrals back and they take treatment with confidence. So that's how I think we can close some of the gaps. And if we discuss only treatment, only 30% of patients will have compliance. So we need to take into account so many factors, particularly in the periphery, like the distance from which the patient is coming. So if the patient is coming from Tawang, if we want to go to Tawang, we'll plan for 2 days. How to go there, where to stop and all. So if the patient, unless we take this factor into consideration, if the patient has to come we offer a weekly chemotherapy, we are sure that we are going to lose the patient for follow-up.
Completely agree.
we need to take into the type of protocol given, the toxicities, because in those areas, there's a patient from Tawang near the Chinese border. There's no PHC even, very difficult. There's no CBC facility as well. So we should not give very toxic protocols where patient may succumb to neutropenia. So taking these factors into consideration is really important, while taking family source of income, because there may be 2 to 3 patients in a single home and a single earner, and social aspects. So initially I used to tell so many things to the patient. Now first 10 minutes I listen to the patient. What is the main concern? So one of the main concern I listen is about biopsy. So biopsy करने से file जाता है, क्या करना? So there comes the role of advocacy group. So what I do now is I give the phone number of a woman who was treated for breast cancer, and they who actually regrowing her hair. So they tell about the course of the disease. Initially I lost the hair, now I am getting my hair back. So the patient gets relief. Okay, it's a process that I will lose hair, I will get it again, so, but the disease will be curable. So all these things will play a lot of role, I think.
Yeah, so beautifully summarized, multiple points covered by Dr. Venkat. I think so what is important is advocacy in each and every form. We might not think that it is actually advocacy, but it is everything. Such steps like giving contact details of a previously treated patient whom I guide the patient is also a part of advocacy. So this is actually very important, and taking consent from the patients who can act as a guide, who have completed treatment, act as a guide to the subsequent patients. This is also important. It is a small form of patient advocacy itself. So these small things will change lives of a large number of the patients. And as we can see, till now, around 7% of the population who is reaching at the age of 75 years is getting malignancy in India. And this is expected to increase to 10% after 20 years. So it is a very huge numbers of cancer is going to come up in the next 2 decades, and we need to prepare for the same. We need to have better advocacy groups, better lifestyle support, and better and we need to focus on close the care gap. This is the tagline for this year World Cancer Day. Hopefully with the availability of many new centers and better facilities, this will be feasible. And the most important thing is what I see is that India is now becoming the hub of randomized cancer clinical trials. I always highlight the fact that this should be highlighted through various advocacy groups, that participation in a cancer trial is not bad. It is the most recommended point in any NCCN guideline. Be it any guideline, you will see the first best possible treatment is patient should be offered to participate in a clinical trial. So this should be a message in the discussion during any advocacy group meetings. And now, for just to give a perspective, we have now 7 clinical trials in the first line treatment of lung cancer. So that paves us way to give the quality treatment which is affordable, because it is not out of the pocket. Even if the patient does not have any reimbursement, the patient can get the treatment most of the time free of cost, and that is one of the standard of care treatments. So I hope that more and more centers can adopt this practice, and through the advocacy groups we can empower our patients to do much better outcomes. I hope I could do justice. I would like to stop here. Thank you.